Now, we will keep you up to date with the latest news on the floods on the eastern seaboard of Australia. We'll be crossing to flood-affected areas again later in the program. But in the meantime, some people reckon it's behind time and missing targets. But Australia's vaccine rollout continues and is moving into a new phase as of this week. 6 million Australians are now eligible to book appointments for doses of the AstraZeneca vaccine through GPs and other clinics. That's anyone over 70 years of age or 55 for Aboriginal and Torres Strait Islanders, and any people with chronic health conditions can get those appointments and vaccines as well. The government expects a rapid ramp up with domestic production of the vaccine coming on stream in coming weeks.
We're on track to be able to meet all of our commitments. They will progressively build towards 1 million. Of course, we have to have the contingency for second doses, but reaffirmed only on Friday that we're in a position to meet all of our distribution commitments.
And we all know there are plenty of people who are a little hysterical about all this, including people in politics and the media. So health officials are calling for us to keep calm and be patient.
It is going to take us some time to vaccinate 6 million people in phase 1B. We do not have community transmission in Australia. We have the time to do it properly. We're not going slowly, we're going as quickly as we can get vaccines, but we're doing it with safety as the paramount objective.
And the Health Minister is reassuring people about supplies and timeframes, reminding them that we're in a very good position.
That means that Australia has sovereign vaccine manufacturing capability locked in at the same time as we start the first of the large general public phases, phase 1B, and it's about saving lives and protecting lives.
Let's get some more on this. The Chair of Epidemiology at Deakin University, Professor Catherine Bennett. Good to talk to you again, Catherine. Are we getting ahead of ourselves yet? We haven't vaccinated everybody in aged care settings yet, have we? That would surely be a top priority before we move on to everybody over 70?
Look, I don't think these are going to compete because we're slowly building up stage 1B. And in fact, we'd already started a bit of stage 1B anyway. They'd already brought it forward for some healthcare workers. So I think you're right. We do want to really focus on aged care as we know how high risk that area is. But at the same time, we're still dealing with people out in the community who, many of whom are in a similar level of risk. They don't have the same living in close quarters necessarily, but those people 70 and over, particularly 80 and over, and particularly if they've got other underlying conditions, it's really important that we start this process of the broader population rollout and engaging our vaccination centres, but also our GPs, importantly.
Now, as you know, I'm one of the least panicky people about this. We're in an extraordinarily good situation. There's zero community transmission across Australia at the moment. We're coming out of summer now and not going through a terrible winter like they are in the Northern Hemisphere. But, there's always a but. If people over 70 get their first jab of AstraZeneca over the next month, for instance, we understand they get some immunity from that, but they won't get the best immunity until they get their second jab, which if it's 12 weeks down the track is going to be right into winter. We're going to have a lot of people, a lot of elderly people in this country not getting their full immunity till we're weeks, months into winter.
Look, that's right. Winter's, it is an important goal to get the most exposed and the most vulnerable vaccinated before we get into the depths of winter. Last year, we actually controlled the exit from wave 1, and even though we still had some community transmission, we kept that controlled right through June. And it was really after that, and for a lot of reasons, not just the weather, that started to take off. The weather was probably a factor, but a minor factor in that. So if we keep travelling as we are and stopping the virus at the border, particularly if our border workers and now in phase 1B their families are vaccinated and we get them done early, then it lowers the risk of that crossover to community. And yes, we still want to keep pushing, but at the same time, we should be in quite a good position that, when we get into the depths of winter, July, August, that we should have the majority of those who have been people we've most worried about being covered even with their second jab. So I think we'll get there, but we do want to see it pick up. We're talking about picking up the rate from about 250,000 doses going out this week to progressively increasing that as we get our GP teams on board. We've got 1,000 of them now. That will build up to 4,000. So that should really start to make a difference in getting those first jabs. And we need to do that pretty quickly, as you say, so that the second jab 3 months down the track isn't pushed out to too far into the August-September period.
Now, and let's stop worrying about ourselves for just a moment and think about other nations. If Australia can successfully, through CSL, produce 1 million vaccines a week, which is what we're being told, that'll happen pretty soon. Once we do look after ourselves, that's going to be massively important for other countries, especially in our region, isn't it?
Look, absolutely. And even while we're still rolling it out, if we can keep pace with our own demand, there is an allocation, that could be made to supporting other countries in the region. And we've seen those conversations happening with Japan and other countries as part of our Quad group, who are looking at making sure that our region's looked after. But we're also members of the other COVAX family, which actually also supports the countries that would struggle otherwise to get the vaccine out to their communities. So it's important that we are supporting them financially, but also logistically to actually get the vaccines out on the ground. And if we've got an issue about production, and particularly supply coming from other parts of the world and Europe in particular, then in fact having production in Australia is probably going to be key to the region.
Yeah, great stuff. Thanks, Catherine. I appreciate your time.
Thanks, Chris.
Professor Catherine Bennett there with more on the vaccine rollout.